Hello, everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. In today's webinar, Dr. Shanta Dube, Associate Professor in the Department of Population Health Sciences at the School of Public Health at Georgia State University, will discuss a special issue of the journal that focuses on education and learning in the context of child abuse, neglect, and related stressors. Dr. Dube will give an overview of the epidemiological evidence documenting the relationship between education and health outcomes, discuss how childhood abuse and neglect affect learning, and present factors involved in resiliency. Right now, I have everyone on mute to avoid background noise. We welcome you to enter any questions or comments you have in the questions box throughout the presentation. The presenter will answer any questions at the end as time permits. Shanta Dube serves as an associate editor of Child Abuse and Neglect, and at Georgia State University, her current work focuses on educating the public about the science of childhood adversity and health and the use of evidence-based integrative health approaches for healing and resilience. Dr. Dube served as an epidemiologist at the Centers for Disease Control and Prevention and was one of the early investigators on the Adverse Childhood Experiences study. Her other areas of research have included the long-term impact of childhood traumatic stress on behavioral and health outcomes in adolescence and adulthood, the contribution of domestic violence on mental health and substance abuse, and the effects of tobacco use on education level. She is nationally and internationally recognized for her research, which includes over 100 publications and reports, some of which were recognized and awarded by the CDC for scientific excellence. Shanta, we thank you very much for being with us today and sharing your insights. Now I will turn it over to you. One moment.
Hi, can everyone hear me?
Sounds good.
All right, Heather, thank you so much for the introduction. Shall I go ahead and start?
Yes.
All right, I'm so excited to be here. Happy Monday to everybody. As Heather mentioned, I was one of the early investigators on the Adverse Childhood Experiences study at the CDC. And a lot of my focus now is really trying to understand how we can do efficient and expedited, if you will, in some respects, research translation of the ACE study findings. So today I'm going to take about 45 minutes to provide a background on some of the work that I've done and also explain how that led to this special issue in child abuse and neglect. So I think we're going to hold questions till the end, but I'll look forward to a wonderful question and discussion session at the end. So I'll just, without any further, this is a quote I always use in all of my presentations because of the importance of really understanding how early life experiences and development are critical to who we become as adults. And actually this quote is by Louis Pasteur. When I approach a child, he inspires in me two sentiments, tenderness for what he is and respect for what he may become. So the objectives of our webinar today is to introduce this idea of the nexus of public health and education as disciplines that really can work together. I'm going to provide a brief overview of what we do in public health and discuss how it's really important for the field in education and how education is really important for the field of public health. I want to also talk about something that we all pretty much know is that education is a social determinant of health. However, when we look at epidemiologic studies, they are primarily conducted amongst adults. So I am going to, in this presentation, kind of walk us through how we can really look at this using more of an upstream approach. I will then highlight a few of the studies in the special issue and then provide some summary points of how to move the needle forward in this area. So what is public health? Public health is a branch of medicine dealing with population health, and it includes hygiene epidemiology, or the study of populations and determinants of health in populations, and prevention based on what we learn. Infrastructural support is a key element of public health, and many times I don't want to say we forget, but it is not highlighted as much as it really could be. And what are we talking about when we say infrastructure? Well, the WHO and the US Healthy People 2020 defines as having these components. So a public health infrastructure is composed of capable and qualified workforce, up-to-date data and information systems that can help inform the work, agencies capable of assessing and responding to the public health needs, appropriate legal and regulatory frameworks to enforce public health measures, and the capacity to monitor and respond to changing patterns and determinants of disease. Also, respond to changing environmental influences, including policy and laws and regulatory frameworks. So in understanding that, what public health infrastructure, what are the components, the practices and services that we do in public health to address these components are to monitor the health status of communities and population, investigate and assess the health problems, and in some cases, make diagnoses about some of the issues and health hazards that are occurring. Inform, educate, and empower people and communities about health issues, and also in that realm, mobilize community partnerships and action to identify and solve health problems. And in fact, the mobilization is key because it's a point of engagement with the population or individuals who are most impacted. Develop policies and plans that support individual and community health efforts with the community engagement and participation. Enforce laws and regulations that protect health. Link people to the needed health resources and services. Ensure that we have public and personal health care workforces that are competent and able to act and respond. Evaluate effectiveness and research for new insights and innovative solutions to health problems that plague our communities and populations. You heard me probably say ensure competent public and personal health care workforces as a very slow and very emphasized component. And there's a reason for that, because that actually directly relates to how public health, the nexus of public health and education, is really needed when we look at the context of learning and education within abuse, neglect, and related stressors. So let's talk a little bit about education and what this means in terms of how it's defined. Education is considered a leading social determinant of health. However, when we think about education in the US and even in international settings, it tends to be very much defined through the institutional definitions. For example, high school, K through 12, early learning environments, preschool, pre-K. These are some of the terms we use in the US. It's also defined as whether individuals have attained a 4-year college degree or whether they've actually gone through technical training and education, or perhaps pursued post-bachelorette, such as graduate education. So when we look at a lot of the studies that have been conducted from an epidemiologic perspective, the way we categorize or classify individuals or populations or subpopulations is based on these, what I call institutional definitions. However, when we think about education, we also need to think about teaching, instruction, and training. These are the methods through which knowledge is acquired and transferred. We need to think about learning and that's the process by which we acquire knowledge and understanding. And I don't have on this slide, but one of the most critical and important aspects of education are who is involved. The who are the students who acquire the knowledge, and also the teachers and the instructors who transfer the knowledge. So it's a shared transfer of knowledge and learning. And you'll see in this this word cloud, education is essential, but we in public health tend to look at it, if you will, very unidimensional. As I mentioned, we look at whether, based on attainment, what are the health outcomes of populations or individuals. But education is much broader. And so we need to think about it in that way. So as a leading social determinant of health, most of the epidemiologic studies have looked at morbidity, mortality, poor quality of life, and the high burden of behavioral risks among persons with less high school. So those are that's the subpopulation that has been focused on in terms of where we see disparities with relationship to health. And the other piece, and I think I want to emphasize this again, is that these epidemiologic studies examine these relationships among adults. So really, it's way beyond the formative years. It's after education, quote unquote, is attained. So if we even look at the most recent data from the US CDC, Centers for Disease Control and Prevention, the National Health Interview Survey, we see that, for example, heart disease is, the prevalence of heart disease is highest among adults without high school diploma. And that's compared to adults with high school diploma or GED. GED is a general educational development degree, and then some college or more. And again, it's using these institutional definitions, not wrong by any means, but limited in many senses. Similarly, we see that Americans without a high school diploma or a GED have the highest rates of smoking. Now, while we've seen declines in all of these groupings over time, you'll see that with the gray bar, let's see if I can use my pointer, that gray bar represents the population with no high school diploma or a GED, and they still have the highest prevalence compared to the other three groups. So moving into how all of this plays into what we know about the impact of early life adversity, abuse, and neglect with health across the lifespan, I want to turn our attention to the Adverse Childhood Experiences study, because much of what we've learned in terms of the risk factors for chronic diseases have to do with behavioral risk factors and lifestyle. The ACE study was actually developed to understand the underlying factors that contribute to poor health across the lifespan. So many of you may be aware of the study, but just briefly, we're not going to spend too much time on this. It was a collaboration between the CDC and Kaiser Permanente in San Diego, California, conducted among 17,000 adult Kaiser Permanente members. And keeping in mind that this study is about 2 decades, over 2 decades old. It launched in '95. So there have been research studies published from '98 to the present. And what we learned from the ACE study is that amongst adults reporting their early life adversities, 2/3 experienced at least one form of abuse or neglect or related household stressors. And these forms of forms of abuse and neglect and household stressors were very common and associated with multiple health outcomes. A couple of other things to highlight from the ACE study are the following. The educational characteristics of the ACE study population, whenever we present on these data, focuses on the fact that 7% of the study sample, only 7% had not graduated from high school or received a high school diploma, whereas it was a highly educated population. As you can see, most of the participants in the ACE study had some college or college graduates. I highlight this because many of the studies that we had seen in the US focusing on the impact of abuse and neglect on later health outcomes were amongst clinical populations or in populations that are characterized as low socioeconomic status. So the study from the findings from the ACE study really highlighted that how common abuse and neglect are across populations. But more importantly, one of the things that I became very interested in was, well, if education is so high in this study population, might that be looked at as a health promoting factor amongst the adult survivors in the ACE study? So I did a small study published in a book chapter to look at the relationship between educational attainment and reporting positive health. And what we found was adults with at least one or more ACEs who reported at least having a high school diploma had a greater likelihood of reporting good or excellent self-reported health. After the ACE study many of the ACE study findings that were published, more of the states within the US were beginning to see the importance of addressing adversity in their populations. The CDC developed and has administered the Adverse Childhood Experiences optional module, which many of the states have adopted as part of their surveillance system. So this graph is data from an MMWR published by CDC. And what I'm really trying to highlight here is the importance of understanding just how prevalent ACEs are and how associated they are with educational level. We really couldn't see this in the ACE study research because, as I mentioned, the educational level was pretty high. But when we look at population level data, we see that, in fact, those with less than a high school education have a very high prevalence of having 5 or more adversities. And if you look at the gray bar, the prevalence of reporting no adversities is greatest amongst those with more than a high school education. Kind of gives a different lens to understanding ACEs, or abuse and neglect in the population, and the relationship with educational attainment. So what do we know about education? It is a malleable factor. So how can I say it's malleable? I'm not saying it's modifiable. It's malleable because we have an opportunity as public health practitioners to work with educational institutes and educational agencies. It is modifiable because individuals can take the opportunity to learn and increase their intellectual capacity, if you will, through further education, if they wish. What we do know is that in the US, even amongst persons who drop out of high school, they can take a general educational development exam, and if they wish, can move on and go apply and go to a 4-year college. Another interesting thing that I've been looking at over the years is just really understanding how education and learning what role it plays in the lives of trauma survivors. What I've learned is from talking through survivors of abuse and neglect is that education and learning is actually a key factor that is associated with healing and recovery. So in one study that I worked on with Jeff Todall and Elaine Walters in the state of Oregon, the Trauma Healing Project, one of the things that was investigated amongst adult trauma survivors is really to understand what would have helped or what helped them. And these are some of the findings from that study: safe relationships, human connection, shared experiences, validation, having choice and actions in healing and recovery. But one of the most important findings is they're saying that there was a need to be engaged in school learning and education. In fact, when I presented to the panel in Oregon and had an opportunity to speak with face-to-face with trauma survivors, the one thing that they mentioned was the importance of learning and education, and in fact engaging in human services and seeking degrees in the human services fields. They also mentioned movement, learning about different types of body work, engaging in practices such as yoga, massage, and dance therapy. And I don't want to omit the fact that they did mention alcohol and drugs to cope. And so what does this all mean? It really means that the nexus of public health and education needs to begin seeing the benefits and importance of addressing education as a social determinant of health, not in adulthood necessarily through epidemiologic studies, but taking an upstream and midstream approach. And it does start with this idea of bringing public health practitioners and educators together to understand what types of activities and programs and training can be brought to school settings. I present the Child Wellbeing Index because from an international perspective, we need to understand that child well-being is more than vaccinations, that it includes material aspects, health and safety, family and peer relationships, behavioral risks, subjective well-being, and educational aspects. In terms of the educational sub-indices within the Child Wellbeing Index, we need to really pay attention to things such as schools' physical environment, ensuring that it's conducive to learning, primary, secondary enrollment, literacy, educational attendance, educational attainment, regular school attendance. That is a key factor, and it's actually a leading risk factor for school dropout. Engagement in learning and curriculum, engagement with the school's social environment, and really understand learning outcomes. So in the context of abuse, neglect, and other related adversities and negative exposures that can occur in the lives of children, we need to connect that more closely with the sub-indices of child educational well-being. The reason we really need to focus on this is because we have a wealth of research and information about how early life adversity, stress, and trauma can impact brain development, neurodevelopment, which has a direct relationship to learning. And this is a figure from the Center on the Developing Child at Harvard University, Jack Shonkoff's group, and it shows very clearly how across between birth up to 19 years, and in fact prenatally, different aspects of neurodevelopment occurring. And if we think about adversity and stress, even prenatally, and how that might impair sensory pathway development. This is very key critical to really understanding this whole nexus of education and health. It really brings in neurodevelopment and how stress and trauma can impair or impact negatively neurodevelopment, which can then have an impact on learning. And in fact, we don't readily see stress, trauma, and abuse, and the impact of abuse and neglect. They tend to be unseen. And the shame and secrecy behind abuse and neglect and related household stressors is a stressor as well. This can impair, as I mentioned, early brain development, learning, and manifest as behavioral difficulties or as somatic symptoms. And we see that early in the lifespan, in adolescence, and even amongst young adults and older adolescents in college, it can lead to truancy and school dropout. So moving to the special issue on pulling together, I mean, there's a lot presented just now that, I presented this idea about, who is public health, what roles do they play, what is education, what does it mean? I gave a snippet. I didn't give the whole gamut of what education is about. But when we think about what happens in the lives of children in terms of abuse, neglect, and traumatic stress, we really have an opportunity to begin to address these issues and really understand how it can impact education as a social determinant of health early in the lifespan. So the whole premise of this particular special issue was really to say, hey, what do we need to increase our knowledge and understanding about in terms of how abuse, neglect, and traumatic stress can impact education and learning. So this special issue really focuses on taking an upstream approach. Many of the studies, there's about 15 brilliantly conducted studies in this special issue that take an upstream approach, but I also made sure and considered the topic amongst college age students, because although we know that the ages of 0 to 5 are critical in terms of brain development and neurodevelopment and the rapid development of the brain and learning, we cannot forget that learning can actually occur through the lifespan, and that when we take on education or we go to learn or pursue education, different factors might play into our ability to learn, and that includes older adolescents and young adults, so the college age students. This particular special issue also takes into consideration, I'm highlighting a few of the studies. I cannot, for purposes of the time limit for the presentation today, go into the depth of all the studies, but I'm highlighting 3 studies. One study in particular that addresses educational neglect. In the field of child maltreatment and childhood abuse and neglect, we have tended to focus on physical neglect and emotional neglect. But this area of educational neglect, I believe, needs to be especially highlighted. And so I will speak a little bit about that in the next slide. We also published a few studies on the qualitative studies to understand experiences of education among children in foster care. We're beginning to see more and more the importance of really addressing children in foster care, working with parents who foster children, and working with educators who have students in the classroom who are in foster care. These are a particularly vulnerable segment of the population that have experienced severe trauma and adversity. So we do need to understand how to help them, how to promote their well-being and promote their healing. And then also in this special issue are studies that not only look at the impact of violence on educational outcomes, but also factors related to educational success and factors that can promote resiliency. So let's talk about some of the articles that were published. Again, I'm only highlighting 3 for the purposes of the webinar today, but I encourage you to download all of the articles from child abuse and neglect from the special issue. So in this study by Melissa Van Wert, Barbara Fallon, Nico Trocame, they really focused on addressing, educational neglect from the perspective of basically really underscoring that this phenomena is difficult to, one, define and to address. So in their study, they address 2 key things: to determine the rate at which child welfare service providers investigate educational neglect in Canada, and identify any trends and rates over time, and to better understand educational neglect and its distinction from other types of neglect, as well as from truancy. And then third, to understand how child welfare services respond to allegations of educational neglect. So they utilized data from 5 cycles of the Ontario incident studies of reported child abuse and neglect. And they conducted some trend analyses. And some of the key findings that they highlight is that educational neglect is more noted as a risk factor amongst younger children. But they also discuss the relation to international trends around how educational neglect is defined, and also how practice can be better formulated around educational neglect using more of an international scope. The second study I'm highlighting focuses on the grip of trauma and how trauma disrupts the academic aspirations of foster youth. And this was submitted by Brenda Morton. And one of the key aspects of this study that came out is that a lot of the studies that have been conducted and published have focused on foster youth in the pre-K to 12 educational levels, but not very much on post-secondary education. So this study actually took on an analysis amongst college students who were in foster care, and it's a qualitative study to understand their experiences and how they were able to successfully graduate from college, some of the issues around dropping out from college and how their early experiences were related to this. So again, bringing back this idea of when we look at the nexus of health and education, not just focusing on the P through 12 or the K through 12, but extending this to the older adolescent population and the young adult population. And then the last study I highlight is one that was submitted by Megan Holmes and her team that focuses on looking at what types of factors or resilient factors are related to academic functioning in maltreated children. I just want to highlight, I'm not going to get into the depths of their study, but they did look at this within a U.S. national representative population in child protective services with a sample size of about 1700. And what I want to highlight in terms of some of the findings they identified with respect to resilience in a stable group are caregiver warmth, caregiver, caregiver cognitive stimulation, and these actually predicted two resilient academic functioning groups. I highlight that because I'm going to talk about in the next few slides about the importance of when we talk about workforce development and the competent workforce, really competency in this day and age with what we know around trauma and stress is helping educators to understand just how widespread trauma is and how it can impact the learning and the school environment. So to that end, I wanted to introduce SAMHSA's trauma-informed framework. It is a framework that has been widely used in the United States to really promote, if you will, this idea of increasing schools and school settings and classrooms that are promoting supportive and safe learning environments. So when we think about the nexus of public health and education, we really do want to think about promoting the science of how early life traumatic stress impairs learning and helping schools. So again, this is where public health can dovetail with education, increasing the acceptance about the science around traumatic stress and how it impacts early life or early brain development, neurodevelopment, and adopting practices that help increase awareness and acceptance through organizational programs, practices, and policies that put learning of children, like learning, the children's learning first. So I'm going to conclude there and I'll leave you with this quote from Carl Jung. Learn the theories as well as you can, but put them aside when you touch the miracle of the living soul. So basically, we have all these wonderful research studies that have been published. We're highlighting the importance of how health and education can coexist, can co-work, can work together and collaborate and partner. But ultimately, it's about doing and adopting. And so I really encourage all of you to take the opportunity to read some of the studies that were published in this special issue and reach out to those authors because they did a phenomenal job. So I'll leave it there and leave it for questions and discussions.
Okay, thank you, Shanta, so much for that information. Let me switch the slide back over. One moment. Okay, great. So now I would like to ask you some questions from the audience.
Sure.
So you touched on this already, but one attendee was asking about a little more information as to why some children have more resiliency to ACEs than others. I don't know if there's anything more you'd like to say about that.
Well, yeah. So as I mentioned, it is definitely in the learning environment a in the learning environment, it's definitely a manifestation of how the adults are able to attune with and connect with the students, and especially have an awareness and an understanding of students' backgrounds in terms of resiliency. Um, I'll just say this about resiliency. Um, One thing we do know, especially in the field of domestic violence, is it takes one. We call it the factor of one adult or one safe, supportive, and nurturing individual in the life of a child who's had a lot of adversities, who can really make a difference. And sometimes it's a teacher and sometimes it's a family friend or a friend's parent. but it's about creating safe, nurturing, and supportive relationships where adults can attune with that child or the children.
Okay, great. Are there specific interventions or therapies that have proven more effective to work with these children in school settings?
Well, I'll say the one thing that we're seeing more and more of is the use of trauma-informed care and trauma-responsive care. In the training that I deliver, it's actually focused. The training that I deliver is focused on adult self-care and well-being. I utilize the two-generational approach, and it's really focused on how adults are able to understand their own responses to stressful situations so that when they respond to children in the classroom, they're in a place of groundedness to work with the kids. There are so many different models and approaches out there. I know that some schools actually do some level of assessment of the children in terms of what their adversities are. And there are some models out there where they have specific toolkits to work with kids on grounding techniques. I can't give you one specific, but the ACEs Connection is a wonderful resource for learning more about the different and various trauma-informed approaches used in schools.
Okay, great.
ACEs Connection is a web platform.
Okay. All right. Thank you. Um, are there specific ages of the children that are critical for interventions?
Absolutely. Um, Early education, 0 to 5, is key critical. Although I will tell you, I will tell you there are some programs in our state that have even focused on building what they call um, building the brain capacity prenatally. So there's a program called Talk with Me Baby, and it's really focused on building literary nutrition, if you will, um, language nutrition early on. Uh, but really, critically speaking, in terms of when we talk about a school setting, the 0 to 5 is the most critical. I didn't put the diagram up here of the development of neural connections, but neural connections occur rapidly between the ages of 0 to 6. And so that's a really critical period because that's when sensory inputs are most impacted. The visual cortex is very critical in learning. So if we can have special attention in mitigating toxic stress and trauma early in the lifespan, it that's when I would say is critical.
Okay. I'm going to kind of combine two questions here. Um, so once children are in school, are there, let's see, when parents are not supportive of these interventions, what can be done? And specifically, are there tools, self-help tools or techniques for resiliency that can be shared with children? And also, are the school staff or counselors trained in these tools?
Okay, so that is the long question. So can we
Yeah.
go to the first part about the parents? Because I want to clarify that.
Okay.
Can you repeat it though? I'm sorry.
Oh, it was just the person was asking about situations when the parents are not supportive of interventions with the children at school.
Right. Okay. So one way that that can be addressed is to bring the parents in and help build their awareness about how stress impacts all of us, including them, on a physiological level. I have found with some of the trainings that I've conducted with adults that it becomes an aha moment. And I've actually done some of these trainings with early Head Start and Head Start parents. And when the knowledge and information is presented in a safe, supportive way, it really does help to for parents of the children to understand the importance of how stress can impact learning. So I would say when there is pushback from parents, engagement is critical, engaging them and meeting them where they are. Because I have found a lot of times that pushback is just, many times it's a manifestation of a lack of understanding and knowledge and feeling threatened. So that's one thing I would say. Um, the other thing I would say is when these trainings or when trauma informed is integrated into school systems, it is incumbent upon the teachers and the staff to become well versed in the area as well, so that they can communicate the information in a safe, supportive, and nurturing manner to the parents. So I would say in terms of the parental piece, and that's always a tricky thing when working with schools because it is hard to engage parents. But my experience has been if they are provided the information, like in a town hall, to understand and really have an opportunity to be engaged, it can change things a bit.
Okay, great. There are
And
a
then the
couple
second part of that question was something else. I missed that.
I think, well, it was about any self-help tools or techniques um, for resiliency for youth when the, let's see, was that the second part? When the parents are not supportive. Oh, and then also, is school staff um, or counselors trained on these tools?
Well, they're not all trained on these tools, and
Yes.
most of the school staff don't even realize that trauma and stress are the underlying reasons they see behavioral difficulties in their students. Many times, and this is not a judgment, it's just, again, a lack of knowledge and a lack of awareness that many times school staff see it as, quote, bad children or bad behaviors. No, actually, behaviors that are seen, behavioral difficulties and behavioral problems are often, if not, a nonverbal communication from the child. And that's where understanding the background of the child or the students that they're working with is so key critical. But
Yes.
there's always some uh, pushback or some hesitancy because, you know, what do we do with this information? Well, what I tell um, school staff is what you do with the information is use it to understand what you're seeing in the kids, not to diagnose. I use the three N's. You know, it's non-diagnostic, non-judgmental, but really as a way to nurture how they're in the learning environment. Um, so that's what I'd say. And in terms of self-help tools, I really um, I really work with school staff to promote their self-care. So that's really about working with their own stress response. And there are so many different tools out there, but we focus on three key tools. Exercise meaning just getting out in nature, getting walking, but engaging in some kind of physical exercise, doing a little bit of the mind body, which is around deep breathing and mindfulness, and ensuring that, actually, it's four, ensuring that diet and sleep are on par.
Hmm. Okay, great. Let's see. One person has a question about trauma-informed care, and speaking from kind of an international perspective, she asks, are other countries doing trauma-informed care in their school systems as a matter of practice? Is there anything you can
As,
tell us about that?
as I understand it, it's starting to yes, it's starting to increasingly be adopted. But I would just say this, um, one has to understand the cultural context because a lot of times what I've learned in different international settings is the one piece that needs to be really addressed globally is building the awareness around the fact that trauma is widespread and recognizing the symptoms associated with trauma. But I will say, in some cultural contexts, especially in the East, some of the practices already in place. I think what it is, because it's part of the culture. Um, but I guess in answer to your question, I can't give you specific countries, but again, going to the ACEs connection, they are starting to see this work around ACEs and trauma-informed care permeate in an international context.
Okay, great. Let's see, just a minute. Here's a question that's a little more broad. This person writes, education and learning is healing. What are the best approaches to benefit children who have inherent learning disorders, such as dyslexia? Many children go through lifelong stress as they go through their education process.
hmm I would say absolutely. Learning is, did she say learning is a stressor? Yeah. I mean, the person said learning is a stressor. It absolutely is. Um, So I would say utilize the five senses and remember that the autonomic nervous, we didn't talk about that in depth in this talk, but the autonomic nervous system that's at the brainstem is part of what's responsible for our stress response, right? So it's a matter of providing grounding techniques for students. And it can be something as simple as um, doing some deep breathing, uh, presenting calming music or calming sounds, calming visual um, screens or pictures, or there's a lot of, in fact, on the internet, you can find a lot of different tools to use with kids where you can actually display calming visual arts and music for the kids. I think
Okay.
it's really key critical to focus on their sensory inputs and bringing the parasympathetic nervous system, which is responsible for our relaxation response, and including grounding, some of these grounding techniques.
Great. So those are applicable if it's a learning disorder, stress, or stress from trauma.
Absolutely,
Yeah.
absolutely.
Okay. Great. Let me go through the questions here and see if there are others that I've missed. There was another question about trauma-informed care. Are these techniques for trauma-informed care also applicable to situations where trauma is also indirect exposure?
Absolutely. So that's vicarious and secondary. And in
Hmm.
fact, actually, in a lot of the trainings that I conduct with adults, that's the focus. It's about secondary stress or secondary trauma or vicarious trauma or burnout, as they might call it, um, amongst the adults so that they are building their own resilience and prepared to respond to situations in the classroom and students' needs. So, yes, I would absolutely, it's very much applicable.
Okay, great. There's another question about, and this may tie in with neglect. Are there studies that address the lack of physical needs being met in the home, for example, food and clothing, and how that affects educational experiences?
I believe there was a few of the studies in the special issue did address that, and more since uh, Dr. David Finkelhor had published a study addressing the idea that the ACEs assessments need to include more and be expanded. More so, we're seeing that in the research body. So, for example, um, poverty is being addressed, lack of material and physical sustenance is being addressed, as well as community violence and aspects of stress and trauma that may occur outside the home. Um, so yes, I would absolutely, that is addressed, and it is a known factor for example, what school systems call truancy, or what Dr. Chris Kearney calls school refusal. These factors are directly associated. What's being discussed around um, not having the proper supports and basic needs is directly related to um, what we see in terms of educational neglect.
Okay. One moment. More questions are coming in. um, at what age do children report issues they're facing in the home, especially when parents are the perpetrators? If parents are the only ones whose voice is heard, we may be missing a lot.
I'm sorry, say the question again.
Okay. At what age do children report issues they are facing in the home, especially when parents are the perpetrators? And then if parents are the only ones whose voice is heard, we may be missing a lot, was the
Oh,
comment.
I see. Okay, so that's a great comment, actually. When I was talking about engaging parents, I was actually talking about engaging parents in the context of schools that are implementing programs or interventions and parents who might not be on board. Okay. What this question really speaks to is what's happening in the family milieu. And if the parents are perpetrating, um, how is that getting reported by the children? I would say children aren't always reporting. They're not outwardly reporting what's happening. They're indirectly or non-verbally reporting through their behaviors, through their lack of ability to focus, through their maybe sometimes behavioral disruptions or lack of attendance. So in the school context, we're talking about something very different. We're talking about really what we're seeing in students and children. Um, Not so much how the students are reporting. Uh, what it's really about is saying, hey, school staff, we need to be aware of where these behaviors are manifesting from, or why the students are having trouble focusing or concentrating or learning, and make it more of um, a collaborative with the parents. So I'm not saying, and helping the parents to understand whatever. I mean, there's only so much we can do to intervene with the parents unless you have in-home, parenting. Uh, sorry, home visitation parenting programs. But it's helping the parents to understand how the stress is impacting the students' learning. I don't know if that
Okay.
answers that question. It's a very important question. I have to say it's a complex question.
Yes. Okay. Thank you. If you have time, Shanta, we have one more question. A couple more. We'll do one more. Hold on. Let
Okay.
me. So this person is asking about peer-on-peer violence and
Mhm.
whether that's considered an ACE experience, and if it also has been looked at as far as educational impact.
Absolutely. So, again, according to Dr. David Finkelhor in his article talking about expanding ACE assessments, peer-on-peer violence is definitely one that's included, bullying, and it's very much related to learning outcomes, because ultimately, when we're talking about childhood adversities and traumatic stressors, we're talking about stress, and we're talking about how it impacts our physiology and children's development, and how that ultimately impacts their ability to learn. So if the stress response is constantly firing, it becomes a situation, as Dr. Bruce Perry has shown with the neurosequential model of therapeutics and learning, that things kind of stay in that brainstem, and it's constantly in reaction, in reactive mode, and it's that place where we need to help kids to get grounded and to build their resiliency and their coping skills. So yes, it's very much a part of the whole ACE, a part of an adversity in childhood.
Okay, great. I think we're going to wrap up there. So thank you again, Shanta, for being with us today. And everyone, thank you for joining us and for your questions. A recording of this webinar will be available, as well as a PDF version of the slides, within 24 hours on our website. We encourage all of you to become members of ISPCAN if you're not already, so that we can continue having informational webinars like these in the future. If you are interested in presenting or have ideas for topics for our webinar series, please contact us at resources@ispcan.org. Thank you all again for your time today, and we hope you have a good day or night, depending on where you are. Thank you and bye-bye.
Bye. Thanks, everyone.